Hi, today's impactful guest is Dr. Elke Zani-Ruttenstock, who is a pediatric surgeon at Washington University and the director of the Pediatric Colorectal Program at St. Louis Children's Hospital. She brings a global perspective to medicine and surgery, having practiced medicine in four countries. And I like to call her the Humanist surgeon because she brings empathy and authenticity with real presence to the OR and all of the healthcare she's involved in. So, thank you so much for being here today, and let's hit it. Elke, what is your moment of impact?
Hi, Katie. Thank you so much for having me. I feel really blessed and honored to be here.
Aw.
Some years ago, when all my when I basically left the straight path, and when I was faced with the most uncertainty in my life, especially around where my career path would lead me. And when I was stripped of all of this, accomplishments for some time and felt really, really, really stuck. And when my career was really threatened, when I thought, maybe, this is the end of my path to becoming a surgeon. In that moment, I realized that I am not defined by that I am enough as a person, and that really a new chapter began showing up also in the realm of medicine, of surgery, more as a human being than just somebody that tries to perform at their best.
That is very deep, and it's really, I think, relatable for everyone who really has part of their identity associated with their work. And when factors outside of our control cause us to have to step aside or lose that part of our identity for a portion of time, we feel almost invisible. How did you feel when you felt like your career as a surgeon was maybe under threat due to factors outside of your control?
Yeah, Katie, I just remember today, I was, there's this annual conference that I love to go. I can't wait, to usually meet basically, we almost saying it's a second family. And when that happened, I was like, I don't want to go there. I don't want to be seen. I don't want to be asked. And I was so, I thought, I'm not even worth it, showing up there. And I did go there in the end. And again, I realized that although it was so uncomfortable, actually nobody, everybody was happy seeing me. Nobody really was too interested of, all the details, what happens. And I realized that again, the showing up part was crucial for me. And again, I realized that whatever else happens is really not defining us. But I was so scared. I was really at a very low, and I think it's also about this acceptance or not wanting to accept that you had envisioned a certain way, a certain path, and it's not gonna happen, and you're suffering because you can just not let go or not accept that God has another path for you, and you're hitting the wall and hitting the wall, and it's just really a lot of suffering.
Yeah, I'm very familiar with hitting the wall. Maybe you can see some indents in my skull. But yeah, I think, you know,
No, you
this,
didn't.
yeah, this is so relatable because, right now we have a climate in the United States, for example, where some of our most revered institutions doing medical research have had massive layoffs. And so we have people who have dedicated their whole life and made commitments and investments in their education and their performance to reach this level, to be of service, and then through external factors having nothing to do with their performance, they're no longer able to practice their jobs. So I just want to clear up to any curious minds that the temporary pause in your career as a surgeon actually had nothing to do with your performance. It was totally external factors. And anyone who's in a complicated two-career, high-achieving, international career will understand that sometimes there are constraints that get in the way. But what's so relatable is this idea of being invisible and not wanting to go to certain, groups where you showed up originally with this sort of, imprimatur of success. And then when that's stripped away, you almost feel naked. I had a very similar thing where I worked at the Boston Consulting Group as a senior consultant for years. And then I worked as a director of strategy at a global biotech. And then I got pregnant and all of a sudden was like a stay-at-home mom, and you go back to these alumni events and stuff, and it's like, what are you doing now? What company are you running? What hedge fund did you create? And it's like, so I'm driving my kids to karate and they're gonna go for their yellow belt, So I think this whole idea of our identity can be so fragile, and that's one of the reasons I was so excited, Elke, to have you on today, is because you're so strong. You have such a strong presence, and you really did take that curveball of life and embrace it. And that's what our viewers are going to want to hear about. So let's just start with what kind of a commitment does it take to become a pediatric surgeon? What's the training?
It's interesting that you asked me, because I had exactly to look into this earlier today. So my path is unique in that way that in Austria, where I started my training, I started in pediatric surgery right away, because in Austria, that's where I'm from, pediatric surgery is a specialty in itself. And when I trained, it was a 7-year specialty. You do rotate also in adult surgery, but it's really tailored to from day one. You want to become a pediatric surgeon, so there isn't any. The decision is made quite early on, right? I was 24 at that time when I decided I wanted to become a pediatric surgeon. I was very intrigued during university by trauma and emergency surgery, and I thought that would be my career path. And actually, then I did 1 month abroad in Finland. And in that department, I was actually on the other side of the curtain, so I was with anesthesia, but I was in the ORs most of the time with pediatric surgeons, and that team inspired me so much because it was a team solely of women. There were like 4 or 5, and all of them had families, big families, at least 3, 4 kids, and I thought, wow, that time I didn't know that this is possible, and inspired by that, I then started, applying for a position at the University Hospital in Austria, and they took me on, and that's when I started pediatric surgery. I would say, it is a calling. You have to, from the get-go, there was this awareness around, if you want to have a better work-life integration, then you probably should not go into that field, because it's really a calling, and it means a lot of times, you have to best not make any plans in the evening time, or be able to be flexible on that, and patient comes first.
Yeah, the patient does come first. And in fact, we rescheduled recording this podcast because
That's right.
on the original podcast date,
That's right.
Dr. Elke saved 2 young people in the OR on consecutive surgeries with 40 minutes in between, another all-nighter. So we have a lot of people that are thinking about careers in medicine. At what point did you hear the calling of this vocation? Like when you were a young girl in Austria, tell us what town were you growing up in? When did you decide that you were interested in medicine, or did you want to be something totally different?
I started, when I was a child, I started being very intrigued by veterinarian medicine, actually. And, I think at that time there was also like a family series on TV, as it always is, right? And there was this one member of the family, female, and she was a veterinarian, and I loved that idea. And I sort of saw myself in her. One of my best friends always told me, though, but if you want to go in veterinarian, you need to, do very cruel things to animals. And I thought, if I really want to do it, I can, do this. It wasn't true what she told me. Anyways, at some point, I realized that it's really the human being that fascinates me the most.
Yeah, I love that. So we're going to move on to your recommendations for medicine, but let's really just sit for a minute and what happened to you and what it felt like. I guess being vulnerable in personal relationships is one thing. And a lot of us run from that, myself included. But then being vulnerable in professional relationships is almost like a whole other thing. So for other people that have lost their jobs and are feeling lost, what was it like, and how did you maybe get yourself to the other side of it, Elke?
Yeah. So yeah, I think I want to add that what complicated everything tremendously is the fact that my husband is also a pediatric surgeon.
Plot twist.
So I think that's where the complication, and actually, of course, it's a gift. It's a gift that we found each other and that we shared this amazing passion. But at that time, I thought, Now I know why so many people, years earlier when I said, when I shared the news that, I would get married with another pediatric surgeon, and they would like, they would not, they would act surprised and raise sort of, at least through their face expressions, their concerns. And I always thought that, but why? I don't understand, because if you only work, as hard as you can, and not lazy, and you really do your best, things will always work out. That was sort of my mantra. That was my belief. And I then realized that, sometimes there is a little bit more to this in life, and it's about timing, it's about being the right person at the right time, and sometimes things are just lining up as you want. And that's, what happened to me at that time. And I remember there was a time period that sort of an inner clock that I gave myself. And so let's say, it's okay to be, enjoying motherhood for that period. But when that internal deadline approached that I gave myself, and when I still hadn't figured out, how my future looks, I started panicking. And what then wanted to come in was this, oh, taking it on yourself and say, well, maybe I didn't work hard enough, and maybe, it's just, there's so many, better people in the world, and that deserve, this more in all of this. And that's the toxic part that at some point I realized this is happening now, that I'm sort of starting buying into this very, very dark story. And I realized that that's the critical part now, right? This is this curveball that I've been given, and it's up to me now to either buy into this story that started to building around it, or to really say, no, I know myself, I know who I am, and I'm not gonna buy into this story.
Yeah. So that just shows how fierce you are of an impact warrior, even in your own head, kind of trying to defang, take the claws out of that story that you had any role in this. And, what do you think was the turning point where you were able to, can we call it a growth mindset, when you were basically able to change your story?
I think, first of all, it was more than just fighting for my career, because I also realized that it means so much to me. And given the complexity with my husband being in that job, I also realized this puts my family at threat, because I realized it's going to be very, very hard to see him doing the rest of his life, his dream job.
Right.
And so this is really, like Tiger Mom comes in and really says that this cannot happen, because it also puts my family at threat. And I think the turning point was really, it was in one of yoga classes. I was so desperate at that time that I told them at the end, it was pandemic, so remote. I said, and by the way, if anyone has any ideas, what I can do, in my situation. And then there was one, friend that said, I want to talk to you. I'm a coach. And before anybody else, she said, talks to you, I want to talk to you. And she basically introduced me into the world of coaching, and that's where when I joined then the coactive coaching, and when we met, and that gave me really that whole new perspective in this. In the coaching training, my entire presence was required. It didn't matter, what I'd done before or after. I needed it. It was all about me, my presence, what I have to give, and what I am able to receive from others, and that changed so much. And to that extent that I realized this is exactly what I want to bring into the realm of medicine, into the world of surgery, pediatric surgery. This is exactly what we need in bringing more in.
Fantastic story. Very inspiring. So, spoiler, you are now obviously practicing medicine. You're a pediatric surgeon at Washington University. You're the director of the Pediatric Colorectal Program at St. Louis Children's Hospital. Did I get that right?
Yes.
Okay.
Yeah, that's correct.
And you did have this period of time when you weren't practicing medicine where you went to coaching. And I've heard you say that it really was a gift in a way, because now you're bringing these qualities of presence to practicing medicine. Can you talk a little bit about what that looks like?
Yeah, so in that time, I started coaching also other pediatric surgeons. The crazy thing, even in my position, that nobody knew about, but had coaching others, finding jobs, and going for interviews, and actually, I realized how strong it makes me. Helping others, exactly what I am, in desperate need for. And the same is happening also in every patient encounter. It's that really, if I am open also to vulnerability, let's say in a situation in our colorectal clinic, where we sit down with patients and families that are really desperate, that are really coming from multiple years of trying to figure it out, and there's frustration, and there is not just stories of success. And if you stop putting a performance on and really acknowledge also that these feelings, that they are okay to be there, they're uncomfortable, to accept also for the team, because we all, of course, love happy end stories and stories of success. But the moment we allow the full picture of emotions, of feelings to be in there in these conversations, that's where also the magic happens in the clinical settings. And you feel that you feel really that that aha moment, or that switch from a lot of tension in the room to actually things turning. I said
Yeah.
yesterday, after a long patient interaction, and said we haven't solved the problem yet, but just having this conversation where the parent felt heard by the team, and together we made plans for the next steps, is part of the healing journey.
Yeah. It is so important as part of the healing journey to feel heard and acknowledged. And by the time people got to clinics, they've tried everything, they've been told everything, and they're desperate. So I've heard you speak about how empathy should be a clinical skill, and how the impact that you care about is bringing presence, authenticity, humanity, empathy into the clinic. So can you share with us, like, maybe take the trajectory of pre-op, op, and post-op? Where are the opportunities to still practice life-saving medicine, still be compliant with the protocols, but show up as a humanist surgeon?
Yeah, my answer would be there isn't a single location or time point in, even in the most critical moments. It's not that, empathy, kindness, respect for each other doesn't have the room. And I think that's what we really we think those are competing interests.
Mm-hmm.
They aren't. We were told, that competence is sort of, if it's it needs to come in a certain with a certain aggression, or a certain tone. And I think we are moving away more and more from that. To give you an example, right? We are a busy trauma service. I like to, since I've started here in St. Louis, I like to go down to the emergency department to meet as many of my emergency doctor partners in non-acute trauma scenarios, so that then when we have to show up for the trauma call, where things have to happen really within seconds, minutes, and according to protocol, of course, but it makes a difference if you know the players, if you know their names, if you don't meet for the first time in that setting. So and that goes through this whole path then, and same in the OR, and the same after a successful life-saving surgery. And communication is still the number one reason. Miscommunication, not enough communication, is still the number one reason for medical errors in 2025. And I think that's really telling. And I think we really know nowadays that competence, skill, that there isn't just that one way that somebody presents the skill, or one archetype of surgeon, that this is the impersonification of competence versus he or she is so soft and kind, cannot be competent.
I love that. That's a super rich answer. There's a lot to unpack there. I mean, the idea of donning the white coat of a surgeon doesn't mean that you have to put on this steely perfectionist demeanor. You can still be open and present and authentic and kind and a great communicator. Secondly, I love your point about building relationships with all your different partners, so that when you are in critical situations, you already have established relationships and you've already begun to build trust. And thirdly, you've made the point that this eliminates medical errors, because a lot of them are sometimes due to inadequate communication or poor communication. So That's really interesting. I wonder if you just spend a minute, like, cultures are encoded and passed on through behaviors and sort of overt and more covert ways of reacting to behaviors. And so I'm wondering, what is it like as a woman, or what have you observed for people of color, getting to these elite tertiary academic medical centers and trying to be present, trying to be authentic, but also needing to project authority? What have you observed, or what thoughts do you have to share?
Yeah, as you know, Katie, I've worked in different medical systems, and I had the privilege to really work together with people from all nationalities, and there's so much to learn from everyone. And I think I also really learned early on that by changing from one system to the other, to realize there are different approaches, different ways to the same pathology, and sometimes it even doesn't feel as the same pathology anymore, but it is. But their approaches are different, and I always say who heals, is in the right. So different ways, and I think I also, being not in my own, in my own country, in practicing medicine, not in my mother tongue, but in in a language that I acquired over all these years. I know exactly, how it feels to, to be not exactly, to, yeah, to be maybe a little bit of an outsider, you know.
Yeah.
And we all, but I think institutions like the one I am in at Washington University, it's really important that this diversity is celebrated and seen as enrichment. And also, if you look at the patients that we are serving, you want to also have an equal representation also of the healthcare providers, in order to be really trusted, in order to be really the hub for the people that you're serving.
Yep. Diversity always drives better outcomes, and equal access and representation is so important. So you've practiced medicine, let me see if I get this right, in Austria, the UK, Canada, and the United States.
That's right.
What observations do you have about the different practices, and maybe what about the impact of government regulation or disease incidence? What compare and contrast observations do you have?
Yeah, so it's a big topic, and of course there's, throughout my entire career, there is of course always reflection happening, because just from what you're faced suddenly with, that you were not used to. I always say that I really realized that there isn't a perfect system. There isn't a single system that has it all figured out.
Yeah.
And I definitely agree with, there is this, what surrounds the healthcare system, and all the government, the role of the government, and the rules and regulations also really shape significantly the way the practice is performed. So, you know, there is the silver lining, I would say, is that the less there is that you can rely really that things get sorted for you,
Yeah.
the more there is sense of community and really supporting each other. That's definitely something that I have experienced, as it also relates to the support in the healthcare system.
Yeah.
It's also a lot about the expectations that people have, coming to a healthcare facility, and about waiting, about room size, or number of patients in a room, and you see, you realize, this is what people are used to, and they're perfectly fine, for example, with a longer wait, because that's just the way it is in that system, right? Versus in another system where the people are not used to any wait. Of course, you have to respond and serve in a different way.
Yeah.
So these are the things that you understand. Specifically in the US, of course, it is a very different healthcare system in comparison to Canada, where I spent the last 12 years. And there's also different expectations in terms of just the fact that the US is way more, there's way more competition, something that was definitely a new aspect to me, that there's competition in town, there's competition in the state, there's interstate competition. And what does it mean to you as a physician to suddenly be faced with competition? Yes.
Yeah, I don't think that's in the Hippocratic Oath. I just have to share this one anecdote you said to put a pin in this, and then we're going to move on to being in a part of a power surgeon couple. But I think I asked you once about practicing medicine in the different countries, and you're like, okay, well, let's say a young child swallows kind of a benign foreign object. Now, in my home country, this child would be fed a lot of sauerkraut and time will resolve. And in the United States, they might have a surgery. So think about that, y'all. Okay. So
Yeah.
you mentioned earlier on that, some of this pause in your career was an extended function of being in a two-power couple pediatric surgeon household. You also have two daughters. You speak 3 languages at home. What languages are they? Obviously English.
Yes.
And
So
what
they speak
else?
English. I speak German also with them, and my husband, who is originally from Italy, he speaks Italian with them.
Fantastic. So how did you meet your husband?
Augusto and we met at a pediatric surgery conference in Switzerland. We always say that I was an Austrian doing research in Dublin, Ireland, and he was an Italian doing his PhD in London, UK, at Great Ormond Street. So, and we met at the meeting. So, both had already decided for this career path. It didn't need any convincing, or the other way around. It was too late to talk anybody out, and we started really as friends, as really comrades, having experienced this incredible enrichment also of having experiences abroad and having experiences really also in research, which is it's in the US, it's a fundamental part of, I would say, every physician's career. Maybe at the time when I trained in Austria or Italy, it wasn't for 100% of the people. So you chose, maybe you want to also add some more time in research. And although I wasn't 100% convinced, at the beginning when this decision sort of was made for me in my training, I then realized the importance and how of a different perspective really it gives you also in asking what questions you ask and what needs to be really researched and to be answered as for our patients.
I'm glad you highlighted that because, as a surgeon, one of your superpowers is diagnostics, and that type of open-mindedness, curiosity, and critical thinking, and knowing how to structure moving from problem to solution that is highlighted in basic science training, I think is so important. So I'm really glad you emphasize that. So let's switch gears because we're starting to run out of time, and I definitely want to hear about your passion for creating a colorectal program. And I guess we're hearing in the news that people are suffering colon cancer at younger ages. And talk to us about the program. What's the dream? What was the need that you saw that wasn't being met?
I would say in the US there are already, I would say, at least in the 2 digits, we have fantastic pediatric colorectal programs, but it's very important also to have them really close to our patients. So and definitely when it comes to Missouri, when it comes to St. Louis, we definitely I need to have a good program that our patients don't need to travel too far. And I would say what I want to offer to our patients is really a holistic approach, with also combining experiences from the different systems, and really, bringing the best of all those experiences to the place here. I think one of my advantages is that I have a very broad network also, that spans really, I would say, over the world, from Europe to Asia, the UK, and in the US, of course. And it's great to be able to, discuss really complex and challenging cases also really with other experts in the field, but being able to provide the care to our patients here. That's of course the dream, and have everything also in the same place. So we are building right now our multidisciplinary team. We are adding physiotherapy into the group. We are working very closely already with our gastroenterologist. In fact, we are leading that clinic together, and we're also bringing in a psychologist, and we are working very close together also with a rehabilitation center, so that it's really that all the needs of our patients can really be addressed right in that one place. And a lot of our patients come from really, really far. I'm very astonished by the commitment of those families that have to drive, I would say a lot of times between 3 and 5 hours to come, to see us in clinic, and that's, very quite frequently. And so we really want to make sure that when they come, that we can really get them get all the needs really addressed in that one setting.
I think of you as such a multi-talented person and so impactful, and this is a great example of it, where you are birthing this vision for a multidisciplinary clinic, which will bring in, just like the mind and the gut are so connected, and we're learning about how the brain health and the gut biome health are integrated. You're actually mimicking that in the structure of your clinic by bringing in physiotherapists and gastroenterologists and psychologists and trying to create this holistic vision. And I really applaud that. I can hear some young viewers saying, ask her about AI. So we got a few minutes.
Yes.
Let me ask you about AI. So I do remember like 10 years ago seeing this video about robotic surgery at the University of Chicago, and it just blew my mind. And the surgeons were saying, you know, it's not replacing us, it's assisting us. And the precision targeting, we're kind of directing it, but we're targeting the robotic arm is facilitating our work. It's giving us better outcomes, smaller incisions, et cetera. So now, fast forward, it's 2025, and we see a lot of talk about AI and diagnostics. Like a lot of people are like, oh, snap, we don't need doctors anymore because we have ChatGPT 5. But I'm interested in your experience. How do you see AI? Is it mainly on the diagnostic side or on the recovery side, or what are you seeing actually in the OR? And just kind of throw the whole AI thing over to you. There you go.
Yeah, I mean, it's a rich topic to
Yeah.
talk about. I think, it can get overwhelming for people. It can get even scary for people, how to keep up with it. There are all these commercials making you feel guilty that you don't know already, 15 AI apps and how to use them. I think for sure, this idea of it, I don't think anybody thinks, oh, yeah, I can do it without AI or, at my age now. So I think we all really embrace it. But definitely, while using it, and I'm using it and I play with it and I try to see in which ways it can really assist me, I still always realize, who is feeding it. There is still like it pulls information. It's fast. It has an immense ability to pattern recognition, but still, it will never replace human communication, connection, and really this leadership over it. And I think we here at St. Louis Children's Hospital, yes, we perform, even today, we perform robotic surgeries. We're really excited to be able to, offer this to our patients. But we want to be wise in okay, where is it really making a difference? Where is it really giving, an advantage over maybe laparoscopic or, even some open techniques? And yeah, where is it great to use, and where are its limitations, at least for now? To give you an example, at the moment, for robotic surgery, we're still, of course, limited because of the robot and the arms. We're limited by the patient size. But I guess, as we, in a few years, even, small baby size, there will be a robot for that. And, it's already happening. But still, it's important to critically review and say, but, this surgery, takes me 5 minutes when I do it that way, and 45 minutes minimum when I do it robotically, and the incision, is, maybe the same. So yes, not everything that can be done is, really then needs to be done. But on the other hand side, there are surgeries where the ability, the three-dimensional and approach and the ability of these instruments to move 360 is really making a big difference and an advantage. And that's where it really has its place, and definitely more and more it will has its place.
That's a great answer about thinking really critically about the use case and the pros and cons of different use cases. So we have two questions left for you. One is, what advice do you have for young people thinking about a career in medicine, potentially in pediatric surgery? If you think about yourself as that person in her 20s deciding you had a calling, what has your journey been like, and what advice do you have for young people contemplating that?
Yeah, it is a field that is really, as I said, I feel it is a calling. It is very rewarding. I had a conversation recently with a trainee that we love to convince to become a pediatric surgeon, right? That's, because you say it would be so fun, to work with you and, to equip you with everything. And I told her that pediatric surgery it's a very broad field.
Mm-hmm.
And it takes years and years and years to really get, the experience in a lot of, pathologies that are very, very rare. So, sometimes we encounter one pathology, maybe per surgeon, like once or twice a year. And, so it's not it's you have, and I said to her, take a look at how you like to study, for example. Are you somebody that really gets a lot of, a joy of going really, really deep and knowing, the every little detail about one subject? I said, if that's the case, right, pediatric surgery will, it's very difficult in our field to become, expert in everything.
Mm-hmm.
So if you like to go really deep, then I think it is probably a field where you really focus on that one organ, cardiac surgery or, hepatobiliary, and become the expert. It's probably more joyful for you and rewarding. And I think it's not that I also desire that. That's why I love now to go deep in colorectal. And I think that's also the future that could look like is, having more people really specialized within the field, specialized in different areas to really be the expert in that particular field, because the patient also deserves that. But yeah, there's always a little bit of, you have to be ready for the unexpected and being comfortable in the uncomfortable, okay? To really, to really enjoy really that if you can get to that point where even the uncomfortable feels comfortable for you, I think then you're in the right place. Because it's an illusion to think that, at some point you just have figured it all out and then it's just a walk in the park. It's not like this. It's humbling. And each time you think like, oh, I got this now, something else comes that you've never encountered or, is really rare and really the unicorn. And I think the more openness you can have for that, embracing the uncertainty of things and this complications that life, gives us, the better it is, I think, as a career choice.
That's a fascinating way of comparing and contrasting that I've never heard before, but that makes sense because now I'm going to call you not only the humanist surgeon, the agile surgeon, because you're embracing uncertainty. You're waiting for those curveballs and the rare presentations. Okay, so here's the final question, Elke. What gives you hope?
That's a good one. I sometimes can get really overwhelmed by, just turning on the news in the morning and seeing like of all the work that needs to be done and the improvements that we need to make as, globally. But the daily encounter of kind people, in the neighborhood, on the streets, and in the hospital, that's really what gives me hope, that I say to myself, like, the vast majority, like 99% of the people in this world want exactly what I want, which is that we are moving in the that we leave this place as a better place than we found it, and that really gives me hope, and that makes me strong enough to not get disencouraged by what maybe the news, what impression the news also are giving us. If you look around, there's so much goodness in the world, and especially, I must say, since we are here, my family and I live in St. Louis, I have made so many new friendships, and the people here are just really amazing and wonderful, and that gives me really the most hope and joy that can be.
Beautiful. Beautiful. What a perfect note to end on. I want to thank you so much for always inspiring me. I know you're a huge inspiration to your 2 young daughters, to your husband, and the rest of your extended family, to all your friends and colleagues around the world that you've practiced medicine with, and to all our listeners on the pod. And you just bring such an open-hearted, humble desire to serve, which is contagious and magnetic. So thanks for being such a strong, impactful leader. And thanks for your time being on the podcast.
Thank you so much for having me, Katie. Thank you so much. It was wonderful to have this conversation with you.